So we're really fortunate in that we have really great support at our residency program for global health. So Dr. Ann Evanson is our faculty lead for the global health elective or pathway. And so she has a couple contacts in India, so she does also training, which is advanced life support for obstetrics training that she does in India. So that's a very easy way to go to a country, provide advanced obstetrics training, and working with Anne to establish networking and partnerships there. She also is working on, I believe, establishing partnerships in Ethiopia as well, working on a hospital there. And so that can be another opportunity for interested residents to go to Ethiopia to work with that. And the program is also very flexible with you being able to choose your own adventure in a sense. So you can find an organization that you are interested in based on web research or from what you've heard from other people. And pursuing partnerships with that organization, our program is very supportive of that as well. So we already have established opportunities for you to go on trips with, as well as if you find an opportunity you're interested in, you're definitely able to do that as well.
So we have quite a number of faculty that are involved. So Dr. Evanson's kind of like the go-to person and is certainly very involved herself. We have a number of other faculty at various different clinics as well. Dr. Kersang is one. He works at WINGRA. He's really involved in also courses, especially in Central and South America. I know Dr. Duffy, also at WINGRA, did a lot of global health in his residency time, and that kind of research has extended into now. So we've got lots of different attendings with different interests, so there's always somebody you can go to with questions or kind of a similar interest as you. You do not need to be in the global health pathway to go on trips. So if you're not in the global health pathway, you generally get about 3 weeks that you could use all at once or broken up to kind of create your own global health experience. The benefit of being on the rotation itself is you get an additional 3 weeks. The most time you can take at a time is 4 weeks, but that means you could potentially go on, a couple different experiences or go back to the same location the next year. So you just have a little bit more flexibility in how much time you have by being on the pathway.
So the global health pathway specifically was one of my favorite parts of residency. So every year, so for all 3 years of residency, we do a 2-week global health curriculum that's in partnership with the UW Pediatrics Department, the OB-GYN Department, the Internal Medicine Department, and the Emergency Medicine Department. And so residents from all these different specialties, us included, come together for 2 weeks and do global health specific programming and curriculum. So we do wonderful didactics and lectures from people that work at NGOs, nonprofits that are doing global health work, listening to the things that have gone well for them, the things that haven't gone well for them, funding that's available to pursue these projects. We've had really wonderful lectures from people providing kind of local health, so for underrepresented minorities in Madison, and exploring kind of the barriers that have been, that they have had to get care in a global setting. We also last year had a very timely lecture on the public charge rule that came out and how that affected our patients that were affected by that in terms of immigration. And so learning about that rule in particular was really helpful for us to help provide care for those patients. And this curriculum also helps prepare you for when you go on global health trips. So they talk to you about what to expect when you're going on a trip, how to navigate the kind of savior complex that is often common when people go on these trips and how to avoid feeling that way. As well as talking about expectations and roadblocks or hurdles that you may encounter on these trips and how to handle that. So it's a really lovely 2 weeks every year that we get to spend with other residents from other specialties, all coming together doing global health. And we also do sim cases. So we work in the sim lab for both weeks, doing cases that you may encounter and residents have encountered on their global health trips and kind of exploring that in a more sim-based practical experience. So again, we are really fortunate in having Dr. Ann Evanson as our faculty lead, who has gone on so many global health trips herself. So she is very in tune with the planning stages of a resident going on a trip. So she works with you one-on-one or two-on-one if you're going with another co-resident to make sure that we're hitting all of the milestones, whether it's something as simple as, making sure your visas are on time, but also the more practical essentials of what to bring, what medical supplies to bring, and that sort of thing. As part of our 2-week global health curriculum programming that we do every year with the other residents from the other specialties, we get a lot of training as to what exactly to expect on these trips, what possible experiences you may have that you may not be expecting, and how to help you prepare the mindset for that. And so a combination of having Ann Evanson be a part of our global health pathway at our residency program, as well as having this established curriculum and programming. I've gone on 2 trips in residency, one to Peru and one to India, and felt very supported and very prepared to go on those trips.
Really great thing with family medicine is there is not a limit to the number of residents on the pathway. So if the whole class wants to be on the global health pathway, everybody can be on it. If it's a couple people, they can also be on it. I think that's also really great because you get to kind of get to know those people in your class and other classes, and kind of hear about their experiences. And we certainly have funding to go around for everybody, so we're not limited by that in any regard.
My 2 rotations, I went to Peru my second year, or India my second year of residency, and then I went to Peru my 3rd year of residency, and both trips were wonderful and very different in what they were essentially. My trip in India, I went with my co-resident Sadie Mitten, and so we went to Kodaikanal in Tamil Nadu, which is in the southernmost part of India. We worked with an organization called FIMRIC, providing primarily pediatric care, doing well-child screenings in creches, which are essentially little community centers for preschool-aged children. We also worked in a private hospital as well as a kind of more public hospital, and got to experience kind of outpatient care in both settings, which was drastically different. So learned a lot about healthcare systems in India, what public versus private meant, and the differences in access to care and cost for each. We had a wonderful coordinator that worked with us that was part of FIMRIC, and we just really had a wonderful time for the 2.5 weeks that we were there. So that was a wonderful experience. Got some hands-on abilities to do some procedures like suture repairs, knee injections, that sort of thing, as well as learn about the health systems existing in India. And then my second trip was to Cusco, Peru. Sadie and I worked with an organization called Serva Cusco, and they're an organization that provides women's health screenings for women in Peru. And interestingly enough, and unfortunately tragically, cervical cancer is one of the leading causes of female mortality in Peru, and so this organization is trying to counter that. And so we ended up doing a lot of pap smears there. There was opportunities to do colposcopies as well. We did cervical cancer screenings, i.e. pap smears, in all sorts of places, whether it was in a marketplace. We kind of found a tented area that we could provide these screenings in private for women, having to pay pretty much next to nothing to get this done. So a lot of female health and women's health was done on that elective rotation. Also got to work in public and private hospitals to get a sense of those different healthcare systems in Peru as well. So that second experience, I would say, was a much more hands-on experience, and it was valuable in its own way as well.
Yes, you definitely can build your own experience. I think that's the big part of Global Health Pathway, and really any of the pathways here. There are certainly certain criteria that you have to meet, but you have a lot of flexibility in events you have to kind of attend and document. Those could look really different, so that could be as simple as reading a book. It could also be going to different webinars. And then in terms of the actual global health experiences, certainly people kind of work within the United States, whether that's in Wisconsin or somewhere else. And then also for abroad, really you kind of get to choose your own adventure. So there are some connections that our faculty have or previous residents have gone to that you could kind of connect with. But if you have a particular program in mind or somewhere you've traveled, it certainly has to meet certain criteria, but you really get to make your own adventure on like where you go, what you do, which I think is really great because we all have different interests and get on the global health pathway.
So I think one of the values of just traveling in general is learning how to be adaptable and rolling with the punches, and especially when it comes to doing global health in a new setting, a foreign setting, in a system that you're not familiar with. You learn how to adapt and make do with the resources that you have. And so, like I had alluded to, this was the first time that I had done any sort of pap smear in anything other than like an office-based setting, and so having to do a pap smear in a tent with no like pelvic floor table set up and kind of working with the resources that we had was definitely a time that I worked on becoming more adaptable and just using the resources that I had. So I think that was one of the most important takeaways is basically in low resource settings you have what you have and you need to provide the best care that you can with what you have. So that was one of, I think, the key takeaways that I took from the experience. I think another takeaway that I took from my traveling experiences and doing global health during residency is appreciating working within the constructs of what that country can offer and that community can offer. So whether that's reaching out to community health workers in that region. So there are women in Cusco that go to the different villages that are maybe not part of Cusco to provide women's health care and prenatal care. So working with them to kind of offer more of an expanded prenatal care to villages that may not be as accessible. So working with the resources that you have within a community, but also working within the health systems within that community as well. And learning about those health systems, like what does public health in Peru or India look like compared to public health in the States, and what does private health look like there compared to the States? And learning about those differences was also really valuable for me as well.
So with COVID, as you can imagine, things have definitely changed. I think the biggest piece is right now, we can't travel internationally, and so kind of, experiences have kind of been put on hold in that regard. However, at least in Madison, there's still a lot of global health activities going on. So we do a 2-week Fundamentals of Global Health course that actually we do with lots of other specialties, so pediatrics, OBGYN, emergency medicine. That's still happening this September. It is going to look a little bit different. I think we're still going to meet together, but it's probably going to be smaller groups, and some of it will be virtual, but we still get to participate in that, which is a really awesome, unique experience to have. Additionally, UW, kind of as a university, has their own global health department, and they hold a lot of different seminars, webinars, meetings regarding COVID right now especially, but certainly other topics, and so you can kind of decide what your interest is and continue to do those things as well. And then additionally, we do have some local experiences that might change over time here, but for example, there's a migrant mobile clinic that happens generally over the summertime that residents can participate in for 1 or 2 weeks at a time. Indian Health Services, we have connections to. That also might look different over the next few months, but that's an opportunity. And then some of our rotations, there's actually built-in free clinics, and so some of those are out in Dodgeville, Richmond Center, from our rural areas where we're catching a lot of patients who aren't insured or undocumented. And so those are also really great experiences that we can still do even now with